As you're aware, we've had to make many changes as a result of COVID-19. A group of physicians, nurses, and pharmacists have been reviewing and have come up with interim changes for managing patients with medical emergencies and rapid responses with a respiratory origin. Our first priority is to minimize the risk of infection for all healthcare providers while providing optimal patient care. As our understanding of COVID-19 evolves, the guidelines for managing medical emergencies and rapid responses for respiratory origins may also change. The following shots emphasize key changes in the care of a patient during a medical emergency. Not all steps of BLS and ACLS are included in each of these shots.
Chest compressions, ventilations, and airway management are highly aerosolizing. All personnel need to wear appropriate PPE for the patients in regards to their COVID-19 status and their risk to exposure to staff. Before starting any compressions, please cover the mouth and nose with a barrier device, whether that be a towel, a surgical mask, or other device. This will reduce the risk of aerosolization. Pocket masks put us at a higher risk for aerosolization. Therefore, they have been removed from every room. First responders will be performing compressions only, no ventilations for their CPR piece. When you identify that a patient is unresponsive, call for help, stop. Is the scene safe before entering the room? If the patient is COVID-19 positive or a PUI, apply an N95 mask and a face shield or a PAPR and gown and gloves. This is prior to starting any compressions.
Sir? Sir, can you hear me? I need help in here.
For all other patients, a barrier mask and a face shield are acceptable, along with gloves. This will expedite that assessment piece and getting to compressions.
Are you okay? Are you okay? I need help in here. Call the code.
Again, before starting any compressions, make sure you have something over the face and mouth. This will reduce that aerosolization. When an AED or defibrillator is available, place the pads, check if a shock is needed. If it is needed, make sure all of your coworkers have either an N95 and face shield or a PAPR device on, in addition to your gloves and gown. Once that has been accomplished, then we can shock that patient.
Prior to intubation, only experienced providers should be performing ventilation. Ventilation by bag valve mask needs to include an inline HEPA filter using 2 rescuers. One rescuer to hold the mask tight to the face using the double C and double E, and the other rescuer bagging the patient. Everyone in the room needs to be wearing an N95 mask with a face shield or a PAPR, gowns, and gloves when we are ventilating the patient. During intubation, chest compressions need to stop. All rescuers need to move away from the patient's head. Chest compressions will resume once a patient has been intubated, the bag valve mask has been attached to the endotracheal tube with an inline HEPA filter, and the endotracheal tube cuff has been inflated. When it comes to staff and supplies, only essential staff should be in the room. Please refer to the guidelines in regards to who the staff are and the roles. The medical emergency cart and non-essential supplies need to stay outside the room. Any supplies or equipment that need to be brought into the room need to be handed off from a person outside the room to a person inside the room, making sure the person outside the room is not having contact with the gloves of the contaminated person inside the room.
Communication is key. To facilitate this communication, make sure you announce who you are and your role when you come in the room. Repeat any orders to ensure closed loop communication. Ask for clarification if any message is unclear, And make sure you're speaking loud enough so people in the room can hear. Having the mask on makes it harder to hear each other. With COVID-19 patients and PUIs, the door will be closed. We need to facilitate communication with pharmacy as they will be outside the room. This is to make sure we get the right meds and documentation of what is occurring with that code. When we have communication devices, whether it's Voicera or a phone, we need to make sure that that is close to whoever is speaking so that the people outside the room are aware of what is happening inside the room. After a medical emergency, there are two types of debriefing that can occur. Clinical debriefing, where we look at the care the patient received, any questions and processes that happened, and emotional debriefing, which may be valuable to utilize the Code Lavender project.
First, you need to ask yourself the question, is the scene safe? This is to protect yourself so you can protect as many patients and other healthcare providers as possible. Note that this practice is consistent with the current interim AHA guidelines. Remember that firefighters, EMS, and police have always been aware of scene safety. In the hospital, we have taken scene safety for granted. With COVID-19, we've been forced to change our thinking because the scene is not always safe due to infections such as COVID-19, TB, norovirus, etc. We need to take time and prepare with appropriate PPE.
All right, we're continually evaluating our guidelines and trying to be consistent with the system-wide guidelines and also with national guidelines and best practices to keep both patients and providers safe. It's a difficult situation sometimes, and it's a difficult moral and ethical situation to be in sometimes when you feel like you have to decide between protecting yourself or protecting your patients. But we're trying to do both, and by protecting healthcare providers, we're also protecting all of our patients by keeping you healthy and also keeping you from getting an infection that you could transmit to other patients. So the purpose of the guideline is not to add any additional victims, but that not only means now but in the future. One analogy you can consider is the airline industry, and they instruct adults to put on a mask first before assisting someone else who needs assistance, like a child. And again, it's not that we don't want to protect both people, it's that the first person has to have oxygen in order to be able to help the second person. Remember, if you have a situation where you feel like you have had to make a difficult decision, we have the Code Lavender available, and that assistance is available to healthcare providers 24/7.